And we have now this presentation from David Herrera, that he's one of the coordinators of the Working Package 2, so he has a very important role in this new project he had in the previous one, but strengthening this new project, and he's introducing the more applied, we could say, aspect, particularly in the policy arena, from the work that we have been introducing. So I want to say thank you to David to being here, and also for the wonderful work he's doing in coordinating this package. So thank you, David.
Thank you very much.
Well, he said he's from the University of Malaga. I didn't say where you're from, but you already
Thank you, Lucia. Thank you so much. Hello, everybody. It's a pleasure to be here. Thank you for coming and sharing this time here, and hopefully it will be a productive and a learning space.
You have to make the speak louder.
I was saying that we're going to share some data, some sentences. If you don't see very well, when I get closer, it's just an invitation. Right, we are presenting, Ana Pizarro and myself, we are presenting this piece of work from the Working Package 2. Here are all the members, so we, on behalf of everybody, we are just representing them. And also Claire Childs, who is a student from the University of Leeds, who has joined us because she got a grant. She is a PhD student of Harriet Churchill, and she is collaborating with us as well. So, as has been explained by my colleagues before, this is a one-year project, and we are in the last months of that project. We should be finished by the end of October. You can see there. We have 20 countries and 57 people. Here are all the countries that are participating, providing data to the project. Just to something that is being said, but maybe with this illustration could be more graphic. Working Package 1, all the work that they've been doing have been working mainly on the assurance protocol, with everything they're doing. And in our case, we are Working Package 2. We are now, we've been working, you'll see in a Gantt chart in a minute, but now is when we are actually analyzing data. So what we're presenting today is very preliminary, what we're doing. But we've been working parallelly, as you will see. This is the timeline. So we had Working Package 1, Working Package 2, two different tasks so far in the process. So we've been working parallelly all the time, but also we've been in touch, attending. We were attending to the meetings at the beginning and coordinating with, between us to provide coherence to the whole process and the outputs eventually. So how it's been explained, there are two levels, national level and European level, and these are some of the results, the jobs that we've been doing so far. As we say, we'll focus now on the Quality Assurance European Guidelines, which is what we're doing from in the Working Package 2. As has been explained, these European guidelines are coming mostly from the National Strengths and Recommendation Report. So this national level will fit this because of the bottom-up process that is being advocated so far. So what was the main aim of Working Package 2? Basically, the European guidelines to develop recommendations at European policy level to ensure high quality, evidence-based, and culturally sensitive family support provision. So basically, we are receiving now, actually we started receiving this 2 weeks ago, so this is why what we're bringing here to you is very preliminary. Receiving these policy briefs, which have been completed with some countries are completing them right now. This morning we received the one from Portugal, for example, and yesterday we received the one from the UK, and we have a few others arriving hopefully soon. So the nationals leader play a very key role here, and they are from this report completing these policy briefs, and from them we're analyzing, this is what we just started, to develop the European guidelines. So this presentation is going to have 3 parts: first part, second part, third part. So basically, just very quickly, I'll show the process to design the policy briefs. Just to get to the template, I'll show you in a minute. We worked for 6 months, 5 months. So actually, we say before, because at the end of last year we were thinking about that. We'll show you the structure of the policy brief, and we'll go straight to the point, which are the data, the analysis. And at the end of this, we'll give you some homework. Yeah, this is a training school. It's going to be very brief, but I will give
Short
you
one.
short one. Yeah, if you want to help us with that. So this is the structure we're going to follow. So the design process. This is the Gantt chart we developed. Actually, it says February. The 11th of January. We already had a meeting to start working on basically designing the process. This was supposed to be February to March, eventually finish in May, because, as we say, we were in touch along the process with colleagues from Working Package 1, attending their meetings. We made a brainstorming at the beginning, set some ideas to the structure of the policy briefs, obviously coordinated with the National Strengths and Recommendations report, which had a different name at the beginning, and it's been a very, very enriching process. Preparing the training school and analyzing the data. So actually we are starting analyzing the data here. So we are a little bit tight because in September we have to finish the European guidelines, and at the end of September we have to present those results in Brussels. So it's going to be a
nice
busy summer. Which is adding some complications because our colleagues are, everybody deserves some holidays, and it's difficult to organize between internally because each one is having holidays in different moments. My university is closing in August. Some people is leaving now in July, and so it's a bit difficult, everything. So lots of challenges. So what's the structure of the policy briefs we eventually got? Basically, 3 points: contextualization and characterization, which is divided in these 3 points. These 3 points are coming from the previous project. As we say, our colleagues say, we are giving continuity to the project, almost 6 years job that we did in the previous project, and this is coming from the working package 2 of the previous project, which was family support conceptualization. So, and it was what we established as a structure. It was reviewed by the colleagues leading that report. The second one is key messages, as Lucia has typed very well for you to see the continuity. Strengths and recommendation. This is coming from the National Strengths and Recommendation report, and is divided in 4 groups: children and families, policymakers, academics and professionals. And the last one is insights and lessons learned. Now I'm going to stop this PowerPoint because I'm going to show you how this has eventually, I'm going to move here. So national policy briefs needs to be brief. This is something we wanted to, because sometimes we start introducing data and we want to be this to be a tool, a helpful tool to pass to politicians and to provoke transformation. So eventually we got a 4-page document. This is a general introduction of each country, Spain, Portugal, Italy, the Netherlands. A small introduction, afterwards contextualization and characterization in a very short number of words, 100 I think here. They have to contextualize and give some general ideas, right? So eventually at the end, every country, this will be published for every country. Yeah, this is the template we developed after all this process, and every country will have this information. Ana Pizarro will explain the data we got so far related to this number 1 point. Number 2, key messages, strengths and recommendations, as we say, for families and children, for professionals, policymakers and academics. Just 2 of them, 50 words. It's very difficult because in 50 words, after all the job done by the national leaders, it's very difficult to synthesize. Actually, we're finding now that it's too brief. So we have to go to the national strengths and recommendations reports and read them to understand, or maybe contacting the leaders to understand what they say. Yeah, and you'll see in a minute. But we are understanding and analyzing that data. But is the few data or the data we got so far is quite enriching and is quite connected, obviously, with the final results shown by Professor Lucía Jiménez. And the last one will be 3 to 5 lessons learned or insights. So publication is SPM for every country will be done and will be in our website at the end of the process. So this is the template we eventually designed and will publish and also pass to the politicians. And from all of them, the 20 countries, will develop the European Guidelines. I'll go again to here. And now I'm going to give the floor to Ana Pizarro, repeating that this is an analysis of data of 9 countries. We are expecting to have 20 policy briefs, the information of the 20 policy briefs, but the deadline was in the middle of June and we had not much time. So we are sharing with you what we got so far, less the UK and the Portugal policy brief that they were received yesterday and this morning, right? The data we're going to share with you from here to the very end, we're going to provide it to you, right? For the homework. Hopefully we'll have time to share everything. If not, we'll give you the homework and you'll have the data. Yeah? And now I give the floor to you.
So I'm going to present the analysis of this section, the first section of the policy brief, that is called contextualization and characterization of family support. And as David mentioned before, we have 3 subsections here. The first one is definition and understanding of family support. The second one is the family support in context, the most practiced way to the provision and delivery of family support. And the third subsection is the political framework of family support. So to let you know a little bit about the process, we followed with my colleague from United Kingdom. We analyzed, we create categories that represent the content in the different subsections. So, because the subsections given by our college of the former working group 2 of the previous cost action identify this, so the subsections are differently, and it makes sense to analyze them separately. So if we go into the first subsection regarding definition and understanding of family support, we have two categories here. Well, actually, we have four, but in this slide we are going to present the content that is represented in this section in the National Policy List. We have family definition. The subcategories are primary and natural context. Is defined. The family support is defined as this. Well, you can see in the document that David gave you. Here represent the different ways of the definition. The focus, what the definition of family support or what parts are highlighted, like child-centered, parent-centered, family-centered. Maria Jose, for example, told it was more deeply understanding of family support. Another category is the dimensions of the definition of family support. Here you can see the different dimensions included in the definitions. The aims of family support, you can see a strengthening of the family, positively influence and impact the nation's well-being, well-being of children and families, regulating quality life in family. We can see here different things because we have different countries and different mindsets of the country. So it's nice to see at European level what things they are taking into account to deliver and to define family support. The second subsection, family support services in context. Here we saw the approach. There are different approaches like universal prevention, family support, selective targeted, areas covered in this provision in context like healthcare, education, social services, social protection and human rights, and specifically what human rights and what does it mean, social protection and human rights. In the same subsection, we have the provision. They are strengthening the provision. How is the provision? How is it represented? We have formal and informal provision, and specifically here you can see the specifications, the particularities of the provision across Europe. And the last category in this subsection is the challenges to provide family support in context, in practice, let's say. And among the challenges, we have financial funding, that Lucia, for example, told before about it. The training professional competencies, that is something really important that we are advocating in this project for that. Monitoring, the most evaluation part of family support in context. The variability of in the quality of services, and lack of evidence-based report that is very in line with our chair and Maria Jose are presenting today. And the last subcategory, the political perspective or framework in family support field, that this means what things the countries are taking into account to make the law or the regulations in family support field. We have the focus, what are they considering while they are making the law, for example. We have the challenges to provide universal support, because now it seems like the family support provision is more selective than universal, so they want to consider the universal approach to deliver the services. Social inclusion and quality, they are not prioritizing qualified family support professional, as I mentioned before, the different understanding of family, parent empowerment, a solution-oriented approach, domestic violence against women, legal protection. They are some things that they are considering. Please take into account that this is something European. This is not something specific for each country. We, as Maria Jose said, our objective is not to make a specific or a ranking of each country. So this is a general analysis of each policy brief. All the information put in together to have an idea what is happening in Europe. Regarding the areas, they are considering the areas providing support. We have social security, employment, family, research, and the last one, again, the challenges to make the regulations and the law and family support, the political climate. It seems that it's very complicated. It's very complicated to have the same idea, and sometimes there are a lot of difficulties to put together and to make these types of regulations. The inequalities at regional level in the system of family support is also a challenge in this area, and the discontinuity between central and regional family support, because sometimes there is the division of this independence while they are providing. It's not the same that, for example, the most representative in the law and so on is the government at national or state area, but then the regional level has their own, they make decisions itself. So there is like this discontinuity between the central, the national thing and the regional, how the national law is translated into the regional level. And I think that's all. Yeah.
Thank you, Ana. So now we can go on point number 2, which are strengths and recommendations. We're going to share with you 3 groups: policymakers, academics, and professionals. Well, before that, as you can see from what Ana just presented, it's very complicated because the contextualization that they are analyzing, Ana and Claire are analyzing, you can see the diversity, the different levels that you were mentioning before in the different countries. We found differences, well, with just data from 9 countries, between North and South, West and East, and so there are differences. So one of the questions we had internally in the working package 2, how can we analyze this data from such different amount of group of countries that they have evolved so differently regarding to family support. So this is one of the difficulties that we having, and what we're doing is basically trying to find the points in common between all the countries, and also the differences between those countries, and we'll try to put all of them together as they Maria Jose and Lucia explained before. As they explained, everybody has space to improve. So the countries more advanced, they have space to improve. The countries who are in the process or just starting in several things, they can improve. And the good thing about this is that we can learn from each other. And that's one of the ideas. So that's the framework or the idea that we having to analyze all of this. Yeah. So now we're going to go with these strengths and recommendations from policymakers or related to policymakers. So strengths. Apparently, the data we analyzed so far is telling us that there are some recommendations by by Europe, which are embedded already in the legal reforms and national policies, which is good, and also the United Nations Convention of the Rights for Children, that already in most countries are kind of has been incorporated. So that's good news in that sense. So that's why it's been qualified as a strength. So launching strategies and pursued strategies in these multidimensional, cross-sectoral, multi-level national child well-being, parenting support, parent education and family support. Apparently this, according to the data, has evolved quite a lot, so it's been considered a strength as well. So looking back, we have this much more evolved than before in these countries, in most of these countries. Another strength related to policy and policymakers, significant investments and reform in some areas of services and also in workforce development. We'll talk about professionals later on as well. So this is good because, as you know, professionals working in these areas, not all of them has better conditions, professional conditions. So something is moved forward, although in the recommendations we'll see in a minute that they claim to do much more. And the last one, the last strength, this is, well, I have to say that what I'm showing now is it's a selection of the more highlighted ideas that we have analyzed in the last couple of weeks. Significant investment and reforms, especially on the groups that more necessities are shown, related to child poverty, maltreatment, physical and health needs, disabilities. So apparently this is something that has progressed in the last years, and it could be considered a strength. So recommendations for policymakers or policies: strengthening rights to social and family support. So we have to, although we just saw that there are some regulations which have been incorporated, we need to keep doing much more about this. Ensure awareness about entitlements. Not everybody, that was mentioned before somehow, not everybody is aware of the rights they have, not even the services they can have for them and their children. So this is, I think, some people is from social education and from social education. So educating society is one of the jobs we have to do in this sense. Yeah. And another one is extensive and resource national plan to reduce poverty and exclusion. So it's claimed to improve this in that sense. What are the recommendations for policymakers? Develop and pursue. Before we say it's a strength, what have been done, but now we want to improve this. We have space to improve for improving. Develop and pursue more multidimensional, cross-sector, multi-level, national well-being. Parenting. It's not enough what is done. It's good what we did, but we have to do much more. As you can see, as is mentioned by you as well, is an ecosystem approach. It's not, we don't want now services, fragmented services, not connected services. Education has to be connected with social work, with the different services we have so far, and legal resources and others. Thank you. Because we know that when we are coordinated between ourselves, the results can be better for these families. So this is going in that direction. And also improve dissemination and knowledge exchange about evidence-based and good practices. Yes? So we'll hear about this in a minute as well for other groups. What other recommendations for policymakers? Invest in services and support to ensure children, parents and families, to strengthen social support for families, and again, reduce childhood disadvantages and meet special needs. One of the focus we are finding are vulnerable groups, families. So that's where we have to make even more efforts if possible. The other one is connected to the professionals, as I say. Invest in improved working conditions, because in some countries, I would say the majority of them, the working conditions are not the best ones, and professional status for those delivering family support services. So we'll talk about in a minute about recognition, yeah, especially recognition and knowledge to the professionals who are developing those good practices. Involve children and parents. This is about participation. Please, let's try to put them in the center of that triangle that I was explained by Professor Lucia. In the very center of everything. All this is because families and children are is the heart, is the core of the whole thing. So they have to participate in the decisions. Yeah. So now we're going to talk about academics. Yeah, and with some ideas. Academics, strengths, family support is an established academic discipline in most countries we analyze so far, which is very good because generally you study social work or social education or psychology or some other disciplines or degrees, but now apparently it's becoming at least an academic discipline, and now that's somehow is getting into the studies of the different degrees. Academics strength contribute to the scientific knowledge about this. This is actually what we're doing here. Learning and building, creating knowledge to improve the services and the society eventually. Academics also contribute to the development and evaluation of family support interventions. So that's why this protocol is an instrument that is trying to do that. But we can, as it's going to be playing in a second here, they want us to participate, if possible, a bit more involved. And several countries report that academics play a key role in a trilateral collaboration with policymakers and practitioners, which is basically the triangle mentioned in the previous presentation. Policymakers, academics, professionals with together, and right in the middle are the families with their children. And what are the recommendations for the academics? Could be more involved in the dissemination of these results, and also in the quality assurance of implementing interventions. They are claiming, the countries are claiming our participation in the quality assurance in the interventions, which is what we're doing here. Parents and children voices can have more central role in academic research. That's related to the one before, the previous, and academics are responsible for the training of future generations of family support researchers. So that's why we are trying to create some knowledge about that. Now we're going to go with professionals, and these two slides are the last ones. Some strengths for professionals. Initial training is a higher education qualification in some countries, and in others is something starting. to be developed in others. And also some countries require to these professionals permanent training. Yeah, so this is regarding training. So you can see here on the first phrase the differences between some countries and others, which are starting that now. Another strength for professionals, they are aware of the transcendence of their work, and they are conscious of the importance of improving the quality of family support interventions, the strength-based and collaborative approach, and also the evidence-based practice. Apparently, they weren't this conscious before, as conscious as now, before. So this is being a step forward, but it needs to improve. But it's a positive data, because it's the eventual services we are providing are better, thanks that we are aware of the importance of the significance of this. Good practices. Numerous countries are doing good practices. Not all of them, or no, we don't have data of all of them, but a number of them are doing good practices. And the knowledge that what they're requiring, the knowledge from these good practices should guide the services of the whole nation, and also Europe, which is what we're doing. Those who develop them should be recognized. Remember, I've been told this before, the people, the professionals doing good practices should be recognized. Collaboration, again, now regarding professionals. This is kind of moving, because in the evidence collected, they say we have seen that countries or professionals, when they find needs, children needs and family needs, they even overcoming difficulties, they try to collaborate. So that shows the sympathy between them. And also alliances, especially professionals with families, to strengthen relationships, to provide a better service, because that alliance is so important. And the last one is just two ideas, one related to coordination, networking, and good practices, some recommendations about that. First recommendation is establish or strengthen coordination mechanisms between professionals from different sectors. Again, the ecosystem approach, and different levels of different administrations. So, and identifying good practices, they should be transferred. Better coordination between academia and practitioners. We have to try to be more in touch with practitioners to provide a better coordination. And training. We had some more ideas, but we are going to share just these two. So training, some data is requiring us to incorporate in the studies, in these degrees, where we study to become a practitioner, working with families, developing family support. We need to learn how to teach this, yes? And also the methodologies as well. So we need to develop good methodologies for them, the students at the university or colleges where they study to become family support practitioners, a better qualification, not just the marks, but actually develop a better job. The content should be distilled, and the competencies from evidence-based practices, and they're claiming more budget, more money for evidence-based programs that they can learn from. What you can see between inverted commas are literally phrases from pieces of evidence. Professionals need to be provided with the necessary training and resources to incorporate family-centered models and improve the evaluation of intervention. Permanent training or continual training is being called in some countries. Is needed for professionals before we saw that in some countries is required, in some others is not, permanent training, to be updated of the contemporary approaches of family support. And this one is very interesting as well, because they are claiming to be autocritic. Can we say that? Autocritic with themselves? So we have to analyze, reflect on our own practice, and if possible, hopefully having the accompaniment of academics or experts who can help us to analyze what we do to improve it. So that's basically what they say, and I think that's very innovative. So by pioneering, no? So that's what they got so far. Yes. Thank you. Well, we have to. Before that, we thank everybody involved. Lots of people is behind this project. People from Working Package 1, for Working Package 2, also cross-sectional roles, as Lucia is here, and some others. Also the national leaders who are doing an amazing job, and also the national teams who are working so far. So we want to say publicly thanks to everybody, because there is lots of people in every country, lots of people working. So we are really, really thankful. Thank you for the information.
Thank you.